Hi, thanks so much for listening to the Listen Up Girl podcast. This is your daily news podcast. We have a packed episode today. We're covering everything from federal government trying to lock trans people out of homeless shelters, a devastating new youth mental health report, and so much more. So let's get into it. We're starting with a story that just dropped this week, and it's infuriating. I reported a little about this earlier this week, but I have some more details. The Department of Housing and Urban Development has proposed a new rule that will require federally funded homeless shelters to house people based on their sex at birth, effectively banning transgender people from accessing emergency shelters that match who they are. Substack advocates are already warning that most trans people will stop seeking shelter altogether rather than risk confrontation or violence inside. And this isn't just one rule, it's a template. Wherever federal dollars are flowing, this logic can follow. Healthcare settings, domestic violence shelters, group homes. This is a policy built on the premise that trans people don't deserve safety. I'll watch this closely, and as we get more developments, I will bring you that news. Next, the Trevor Project mental health report. Let's pay attention to this next story because it matters. The Trevor Report released its 2025 National Survey on Mental Health of LGBTQ plus youth people today. And for the seventh year in a row, the findings are devastating. Based on the response over 16,000 LGBTQ plus youth, people ages 13 to 24, the survey found that 36% seriously considered suicide in the past year. For trans and non-binary youth, that number climbs to 40%. That is 1 in 10 attempted suicide. This report is clear this is not about identity. Anti-LGBTQ plus policies, victimization, and the rhetoric are directly driving these numbers. And 15% of LGBTQ plus youth reported being threatened with or subjected to conversion therapy, with significantly higher suicide attempts among these youth. And here's the gut punch. That this spring, the U.S. Supreme Court issued a ruling that puts states' ability to ban conversion therapy for minors in serious doubt. The research says it causes harm. The court is making it harder to stop. A separate new study found that 97% of LGBTQ young people can still name at least one source of hope in their lives. That matters. Our kids are resilient. They deserve so much better than what they are getting right now. If you or someone you know is struggling, reach out to the Trevor Project. The Trevor Project is at thetrevorproject.org or text 988 and press 3. Next, anti-LGBTQ plus riders in federal funding bill. Republicans in Congress have been quietly attaching anti-LGBTQ plus provisions in a federal funding bill, and we need to talk about it a little bit more. The riders include a provision that appears aimed at eliminating the U.S. Special Envoy for LGBTQI plus human rights, another that would cut off federal funds from any organization that provides or promotes gender-affirming care, and a third that expands the so-called global gag rule, barring foreign organizations from receiving funds if they support LGBTQ plus rights or transgender identity. They are defunding the advocates, they're cutting off global organizations doing life-saving work, and they're doing it buried inside a must-pass spending bill. This is a coordinated strategy to use federal checkbook to erase LGBTQ plus people from public life, both domestically and internationally. It deserves a lot more attention than it's getting, so I am bringing you this news. So stay informed as I bring you more details as they are released. Next, Tennessee trans tracking bill. This one didn't get as much attention as it should have, and it's alarming. Tennessee Republicans passed a bill that would require all gender clinics in the state to report monthly health data on patients receiving gender-affirming care to the Department of Health. The data would include age, sex assigned at birth, county of residence, prescribed medications, and the dates of prescriptions of surgery or referrals. Lawmakers are calling it an outcomes tracking measure. Critics are calling it what it looks like, a surveillance system, and that fear is grounded in recent history. In 2023, the Tennessee Attorney General Office was already able to obtain detailed medical records of transgender patients at Vanderbilt University Medical Center. Protesters filled the Capitol when the House voted, and at least one demonstrator was physically removed from the gallery by the state troopers. The community showed up and made their voices heard. The fight is not over. Next, Florida legislative session wraps. Florida's 2026 legislative session is officially closed, and there's a complicated story to tell here. Equality Florida is reporting that advocates stopped or neutralized 4 out of the 5 anti-LGBTQ plus bills this session, including one that would have allowed employers to legally misgender transgender co-workers, and another giving the Attorney General sweeping authority to sue teachers and doctors who support trans youth. That happened because thousands of Floridians showed up, sent emails, made calls, and packed committee rooms. But one bill did pass. The Anti-Diversity in Local Government Bill, forced through in the final days of session with suspended rules, and the public locked out of the process. That's the playbook. Wear people down, then move fast where there's no one looking. 4 out of 5 stopped in real progress, but the one that passed is a reminder that the fight never fully ends. Next, in California, it fights back with a $26 million for trans health care. So let's talk about a state that's doing it right. Equality California is advancing a $26 million budget proposal to safeguard access to transgender health care by creating a state-only Medi-Cal funding pathway to stabilizing the provider network, directly in response to the escalating federal attacks. This is what it looks like when a state refuses to let Washington dictate its values. California is essentially building a firewall around trans health care so that even if federal funding disappears, the care continues. All priority bills have already been cleared, their initial committee hearings, and moved to appropriations on May 14th. Other states should be watching and taking notes. And then we'll close with queer pop culture. May watch list. So let's close with something to look forward to because May is a solid month for LGBTQ plus content. Drag Race All Stars 11 premieres this Friday, May 8th on Paramount Plus. 18 fan favorite queens are back in a high stakes tournament of All Stars format, competing for $200,000 prize. On May 19th, Netflix drops Wanda Sykes' Legacy, a new comedy special directed by Julia Dash and filmed at Sykes Alameda, Hampton University. An hour of sharp comedy from one of the best in the game. And if you haven't already, The Devil Wears Prada 2 is in theaters now. The original cast is back, and that's all I need to say. I will be seeing it this Saturday. That's your Listen Up Girl for today, May 6th. A lot happening out there. Some of it devastating, some of it enraging, and some of it as a reminder this community is still here, still fighting, and still finding moments of joy in the middle of it all. If today's episode resonated with you, share it, leave a review, and follow us wherever you listen. Until tomorrow, stay informed, stay engaged, and I will be back tomorrow with more LGBTQ plus news. Thank you.